Alrighty, so we'll check here. Okay, well, how you been feeling?
Pretty good.
Wonderful. So we're gonna check our legs first, and what this is looking at is we're looking for any leg length inequality within the difference of the feet, and that has to do with in the brainstem, any pressure being put onto the brain, and then contraction of the muscles back up to and throughout the back. So if there's any sort of discrepancy in the legs, we'll be able to know that there's something going on at the atlas, and that's one of the signs we take to check to see if you're in the correct position or if you're back out of alignment. All right, Zayden, go ahead and turn your head to the right and to the left. Good, and back to center. Excellent. Okay, let's go across the hall. All right, so we're using the Spine Master here. This allows us to be measuring the person in 3 different dimensions. So we're gonna look at the pelvic tilt, we're gonna look at the rotation of the pelvis, and then the overall lean of the body one way or the other. This will show the body's compensation pattern of how the atlas has misaligned and the effects that the decrease in communication from the brain to the body are having on the body itself. So from here, we're gonna put the hip calipers right on top of the pelvis. And so right on top of the iliac crests, you're gonna feel the pressure there, but it shouldn't be painful. We're gonna come back out and we're gonna compare then where we're at. All right, we're seeing a little bit of tilt in the pelvis there. And we're gonna feel for where she's standing at here. She is leaning off to the right by a little bit. She's at a 1/2 degree. And so now we're looking at the pelvic rotation and she's sitting at right at the 1/2 mark. So she's at a 1/2 degree rotated backwards on that left side. And we'll head back to the room and we'll compare your measurements. Okay, so I am seeing legs at a 1/4 here. Pelvis is at the 1/2 mark. Rotation is showing up at that 1/2 as well, and you're off to the right. I was off to the right by 3/4. Okay, well, let's get you corrected. And we'll jump in here. So we have to raise up the headpiece to get it level and get her into neutral. And then let's get you down onto your left shoulder. Excellent, so we're gonna make sure feet are stacked, pelvis is level, shoulders are stacked. Make sure the head tilt is in the proper position. I wanna lift up her head and always just make sure that we're right where we need it to be. So each person's unique, so we have to make sure that their head position is in the correct spot. And this is vital for the actual correction itself so that gravity isn't fighting us and we're able to use gravity to assist in the correction. And I always make sure that the muscles are nice and relaxed. She's nice and stacked and head's in neutral. Excellent. So from here, we're gonna measure out exactly where her contact is. To do so, we have our own rulers that we keep in our pockets. So based off of her x-rays, we're able to measure out exactly where we need to be placing our hands and positioning our bodies to deliver the correction. And then once we have that, we're able to position ourselves properly for the correction. There's no popping or cracking, there's no twisting or turning. It's a very gentle, very precise correction that is targeted specifically for you. And that is one correction. So it's a series of corrections themselves. Each one is just like slowly nudging the door closed rather than slamming the door closed. So the tie itself, and Dr. Abwalkal wears a necklace, and that's to help us get into the proper position for our bodies. Essentially functioning as a plumb bob. Okay. So go ahead and tuck your chin slightly, come on up, and we'll post-check. So every time after the correction, we always make sure that we re-measure and we're seeing those changes. If we're not seeing those changes, then we go back after it and make sure we get the full correction out of it. Okay, so first things first, we always gotta check the legs again. In her case, she comes out to perfectly even. So we're right where we need to be here. Let's go across the hall again and we'll check your standing measurements. All right, again, going right on top of the iliac crests. All right, and so now she's showing up right at the 0 mark. Rotation's less than a 1/4 here, right close to 0. So we know rotation's doing better. The pelvis angle is doing better. So her hips are level now. And she's coming back to standing taller. And so we know the atlas is back in its proper position.